Hey there. Ready to dive into a healthcare system that's, well, let's just say it's got more twists and turns than a spy novel.
Ooh, I like that. And you're not wrong.
Today we're taking on Cuba.
Yeah, Cuba. But, and this is important, we're going beyond those idyllic beaches and vintage cars.
Right, we're talking about the reality for the doctors and nurses actually working in the system,
hmm
especially, think COVID-19 pandemic.
And that's where things get really interesting really fast. You see, the image Cuba projects internationally about its healthcare system, well, it often doesn't match up with the experiences of those on the ground.
We're talking firsthand accounts, leaked documents, the works. We've got a lot to unpack. One of the things that really jumped out right off the bat is how Cuba's basically MIA in all those international reports about healthcare workers during COVID.
It's a massive red flag when you think about it. I mean, you'd expect a country, especially one praised for its healthcare, to be front and center in reports from the WHO, PAHO.
Right, but Cuba,
Nowhere to be found.
especially when it comes to how the pandemic hit their healthcare workers. Makes you wonder what they're not telling us, right?
It's a question that should be at the forefront, especially considering how tightly the Cuban government controls information.
Oh yeah, that's state-run media.
It makes it incredibly difficult, borderline impossible, to get independent, verified information out of Cuba. So what we have to rely on often are these leaked documents, these firsthand accounts.
Which takes us to some seriously concerning stuff about healthcare worker deaths during the pandemic. It seems like there's a pattern of underreporting, maybe even straight-up misreporting.
Right. It's not just about the numbers themselves, it's what that lack of transparency says about the system as a whole. Take the case of Dr. Giovanni Stilio, he was a provincial health director, and Dr. Quino Rojas, an imaging specialist. Both of them, tragically, died during the early stages of COVID.
Yeah.
Their deaths. Completely left out of Cuba's official COVID-19 death counts.
Seriously, just gone.
It was only after their colleagues started raising questions online, questioning why these deaths weren't being acknowledged, that things changed.
Wow.
And this pattern, let's call it what it is, this obscuring of COVID-19 deaths by putting them under pneumonia or just general respiratory failure, it's troubling, to say the least.
It's like trying to figure out how bad the pandemic really was without knowing how many people were actually infected.
Exactly. And it makes you wonder, what's the impact on other doctors and nurses in Cuba, knowing that the risks they're facing might not even be fully acknowledged?
Right. If they can't trust their own government to be upfront about those risks, who can they trust?
Exactly. And it creates this really difficult situation for healthcare workers who might be seeing problems firsthand but are afraid to speak up.
It's not just about the virus itself. Our sources point to these chronic shortages of even basic medical supplies.
And pressure to reuse equipment.
Equipment that's meant to be single-use.
You see, even before the pandemic hit, Cuba's healthcare system was already stretched thin. I mean, we're talking reports from as early as 2017, pre-COVID, of doctors resorting to boiling their own medical equipment.
At home.
At home, because there wasn't enough sterilization equipment at the hospitals. Think about that for a second.
That's just, wow. What is that kind of improvising, reusing things that shouldn't be reused? What does that do in the long run? I mean, for healthcare workers and their patients.
Well, it's not good. I mean, on a basic level, it massively increases the risk of infection for everyone involved. And psychologically, it's a recipe for burnout. You're constantly worried, anxious, knowing that you're putting yourself and the people you're trying to help at risk. And then the pandemic hits. Talk about adding fuel to the fire. Suddenly, you've got a global health crisis, and you're operating with a system that was already struggling. There's this one account from a doctor in Cuba really stuck with me. They were talking about walking into the ICU right at the start of the COVID outbreak, and they had nothing. No running water, no gloves, no protective gear, nothing.
It's terrifying, honestly, to think of those doctors and nurses going into that kind of environment completely exposed. It really highlights how these systemic issues, they have real human consequences. And what makes it even more complicated is that whole culture of fear we talked about. Where speaking out, raising concerns, it's not just frowned upon, it can be downright dangerous.
Exactly. It's like they're stuck between a rock and a hard place, right? On the one hand, they're dealing with these impossible conditions, shortages, risks. And on the other, they know that speaking out could mean jeopardizing everything, their careers, their families, their freedom.
So what happens to those who do speak out? What are the consequences?
Well, let's just say the Cuban government doesn't take dissent lightly. We're talking disciplinary action, demotions, even getting fired. And that's if you're lucky. There are documented cases of doctors being blacklisted. Basically, you speak out and you can kiss your career in medicine goodbye.
It's chilling. It's like they're trying to silence the very people who are best positioned to identify problems to help make things better.
It creates this culture of silence. Doctors, nurses, they're afraid to report issues, even if it means putting themselves or their patients at risk.
Which, when you think about it, undermines the whole system. If nobody trusts the system enough to point out what's wrong, how can it ever improve?
Exactly. It becomes self-perpetuating. And it raises some serious ethical questions. I mean, shouldn't the well-being of healthcare workers, the people on the front lines, shouldn't that be a priority?
You would think so.
Yeah.
Instead, it seems like maintaining this image, this facade of having a world-class healthcare system, that's what matters most, even if it means ignoring or silencing the people who know the truth.
It's a contradiction for sure. And it's something you see play out in other areas of the Cuban healthcare system too. Like, take the experiences of international patients. They often have a very different experience than the average Cuban citizen.
Yeah, you hear these stories about tourists, right?
Mm-hmm.
Describing hospitals that sound more like war zones than places of healing.
And that's the thing, you have these stark differences. On the one hand, you have hospitals like CIMIQ, which is basically reserved for the Cuban elite.
Right, the high-ranking officials, party members, that kind of thing.
Exactly. And those hospitals are known for having decent facilities, access to resources. But then you have the hospitals where most Cubans receive care, and it's often a completely different story. Dilapidated buildings, shortages of staff, basic supplies.
So two very different realities.
Precisely. And it makes you question this whole narrative of Cuban healthcare being this great equalizer, because it clearly isn't. The quality of care you receive seems to depend on your political standing or how much foreign currency you can bring into the country.
That's a lot to think about.
Yeah.
But let's shift gears a bit, talk about the data itself. Because officially, Cuba boasts a relatively low COVID-19 death rate.
Ah, yes, the numbers.
So on the surface, you might look at that and think, wow, they managed the pandemic really well.
You have to be careful with numbers, especially coming out of a place like Cuba. Remember what we said about information control?
So should we just disregard those official numbers entirely?
Not necessarily, but I think a healthy dose of skepticism is always a good idea. For one thing, they have limited testing capacity, so there were probably a lot more COVID cases than they were able to officially record.
Meaning the death rate could be misleading.
Exactly. And then you have the issue of how they classify deaths. Remember that whole thing about misclassifying COVID deaths as pneumonia or respiratory failure?
Right, so they're intentionally muddying the waters.
It makes it incredibly difficult, if not impossible, to get a clear picture of the pandemic's real impact.
It's like they're playing a game, and the stakes are people's lives.
And it makes it that much harder to get a handle on the truth, for researchers, for organizations trying to help.
It's disheartening, frankly. It feels like this whole idea of transparency, accountability, it's just absent.
And the people who suffer most, the people of Cuba, especially those working in healthcare, they're caught in the middle.
You can't really have a functioning healthcare system when you don't even acknowledge the problems, right?
It's like trying to build a house on a foundation of sand. Sooner or later, it's all going to crumble.
And it's not just about the system itself, it's about the people who rely on it. The everyday Cubans who need health care. What does it mean for them when the people who are supposed to be caring for them, the doctors and nurses, are silenced, are afraid to speak up?
It creates this environment of mistrust, uncertainty. You start to feel like accessing quality healthcare is a luxury, not a right. And that's a dangerous path to go down.
Speaking of access, we've touched on the differences between how international patients and Cuban citizens experience the healthcare system. But maybe we should dig into that a little deeper. Like, there's this whole thing about Cuban medical missions abroad.
Oh, the missions. Yeah, that's a whole other layer to this story.
On the surface, it seems like a good thing, right? Sending doctors to countries in need. But some of the stuff we've uncovered paints a much more complicated picture.
It's one of those things where you have to look beyond the surface, beyond the PR, to see what's really going on. Because while, yes, sending doctors to countries facing shortages, that's great on paper, but how those missions are structured, how they're financed, that's where things get murky.
Give us an example.
Well, for one, the Cuban government, they make a lot of money off these missions. Countries pay them a fee for the doctor's services,
Right.
but the doctors themselves, they only see a fraction of that money.
Wait, seriously?
Yeah, and that's just the tip of the iceberg. You have all these reports of Cuban doctors working in these missions facing, honestly, exploitative conditions, restrictions on their movement, their communication. Some haven't been able to even talk to their families back home freely.
So these doctors are basically being exploited for their skills, their labor, and the Cuban government is profiting from it.
It's a criticism that's been levied at the Cuban government for years by human rights groups, even some of the doctors themselves. It raises all these questions about what it really means to provide humanitarian aid. Because if you're doing it in a way that benefits you more than the people you're claiming to help, is it really humanitarian?
It's a good question. And it kind of makes you question everything else we think we know about the Cuban healthcare system. It's like, if they're willing to do that, what else are they willing to do?
And that's the thing about this deep dive. It's about more than just Cuba. It's about asking those tough questions about any healthcare system anywhere in the world, who benefits, who's excluded, and how do we create systems that are truly equitable, that put patients and healthcare workers first.
It's a lot to grapple with, for sure. But it's a conversation we need to be having. We've seen firsthand how a system that, from the outside, looks like a model of universal healthcare can actually mask much deeper problems, problems of control, of
Yep.
inequality.
We can't ignore those problems. We can't let ourselves be swayed by narratives that don't hold up to scrutiny.
Well said. We have to be willing to dig deeper, to look beyond the surface, to listen to the people most impacted by these systems, the healthcare workers, the patients, because at the end of the day, healthcare is about people.
And until we start treating it that way, until we prioritize the well-being and dignity of all people, we're never going to achieve true health equity.
That's a powerful message. And on that note, we'll leave you to ponder these questions. Until next time, stay curious and stay engaged.